Hi, everyone. My name is Dr. Tamara Gayle, and I'm a hospitalist at Children's National, which means I take care of kiddos who are sick and have to spend the night in the hospital and help them get better so they can go back home and live happy, healthy lives. Today, we're going to be talking about some important questions that have come up around the COVID-19 vaccine and your little ones. So, a lot of parents and families have asked, is the COVID-19 vaccine safe for children 12 and up, and which vaccine is safest for them to take? So currently, only the Pfizer vaccine is approved for children 12 and up. Moderna is still doing trials, and so we'll have to see how that shakes out. But currently, only Pfizer is safe for kids 12 and up. And they have done trials involving kids in this age group and have found that it is not only safe, but also effective against the COVID-19 virus. So definitely recommending children 12 and up to get vaccinated. And again, that's with Pfizer. Other questions that have come up include, is the vaccine safe for children with additional health concerns or specialized needs? So what if my child has allergies, or if they're autistic, or they have ADHD? And, so far we haven't found any contraindications. That means that there aren't children with specific health needs that we are, advocating that do not get the vaccine. So we think that it is safe for any of these children with these specialized needs to get vaccinated, which is really important because, obviously some of our children are at increased risk of having, other issues come up if they do get sick, which we have unfortunately seen, over this last year. So definitely want our kids 12 and up, even if they do have additional health concerns, to get vaccinated. So this one I've heard all the time. Will the COVID-19 vaccine affect my fertility? And, as a woman myself, I can, definitely understand why this is concerning. But the great news is that this was unfortunately a rumor that got started on the internet. And we all know how fast internet wildfire spreads. And there has been absolutely no confirmed reports that this is true. So just going over again, this is a rumor that was started early on based on some information that was not correct. So we have no studies, we have no reason to believe that the vaccine will affect your child's future fertility or your current fertility. If you are listening and thinking about your own fertility right now. In fact, we have found that the vaccine appears to be safe in pregnancy. And we know that lots of women have gotten pregnant safely after getting the vaccine themselves. So this is one that's come up and seems a little strange. How can we give a 12-year-old the same dose as an adult? So, again, we spoke earlier about the trials that went on. So in the trials, they started, with different doses and found that the same dose that we give adults was also safe and effective in 12 to 15-year-olds. So they are, in fact, getting the same dose. And that was what they used in the trials to get approval. So again, we're looking at thousands of kids and their families that bravely went forward. So we'd be able to have this information. Interestingly, they are looking at lower doses right now for the younger kids that they're currently doing trials on. But we know in the 12 to 15-year-old group that was newly approved that it is safe to use the same dosing and the same dosing schedule. So again, that's because we were able to do trials safely, and we have this information showing that they mounted an excellent immune response to this dose, and that's what they're getting. So, as a parent or caretaker, you want to know, how can I calm my kids' fears about getting vaccinated? So there's lots of different strategies. So, one of them is, of course, to talk about the other, brave kids that have already been vaccinated and that it's been safe and they haven't had, any problems so far, for the most part, to remind them that they've already gotten lots of other vaccines that have protected them against other illnesses like, polio, chicken pox, measles, mumps, rubella. There's so many that our children safely get vaccinated against, and this is just another vaccine that we've also proven to be safe. If you yourself, as the parent or caretaker, have already gotten the vaccine, and you have pictures or videos or whatever, you can show them how you did it, because kids are oftentimes they feel better if they know that the adults in their life have already done something and that they've been okay. So talking about that is really important. And if you know of other family members or kids or people in your child's circle that have already gotten vaccinated, it might be helpful to have them talk to your child and let them know about their experience and how things went. Those are all definitely things you can try. And of course, now after listening, you're like, well, I know it's safe. I know what to do to, help to make sure my child feels ready. And of course, your question is going to be, where can I go to get the vaccine for both, myself and my child who's 12 and up? Do I need an appointment or do I need insurance? How does that work? So for yourself as an adult, I would look at the DC Department of Health, or if you're in Maryland, Virginia, wherever you are, the vaccine rollout has been robust, and you can find it at CVS and Walgreens and your grocery store, lots of different places. So probably just a quick Google search away. And if you're looking for information about your child, we're going to be showing you the website for Children's National. And on our Q&A page, we'll be able to let you know exactly where to go, how to sign up, and what to do. I would say for the most part, you do need an appointment. That's because wherever you get the vaccine, it needs to be used within a certain time frame. So it's just helpful for them to know how many people are getting it, when they're getting it, that sort of thing. So I would say for the most part, you are going to need an appointment. But the great part about it is you absolutely don't need insurance or any proof of insurance because the vaccine, whether it's for yourself as the adult in the family, or if it's for your child who's 12 and up, is completely free, no matter where you get it or how you go about getting it. So insurance is absolutely not going to be a roadblock for getting yourself or your child vaccinated. I'm really excited that I was able to share information today with you all. Thank you all for tuning into this episode and to learn more about the COVID-19 vaccine for yourself and for your child at 12 and up. Please see our website for more information, as I mentioned, about how you can get your child vaccinated. That is 12 and up. Be on the lookout for more information coming this fall, likely on how to get your child vaccinated that is younger than the age of 12, and continue to share good information for those in your circle, because there's unfortunately a lot of misinformation that's going around about the vaccine, and all of us are going to be safer if we move towards continuing to be safe. So, washing our hands, wearing masks where we need to, and of course, getting vaccinated. I hope that you all learned something. And like I said, definitely share with friends and family, because the more we know, the stronger and more and healthier we can be as a community.